like, but just a brief description of what we do is that we help anybody who's impacted or affected in any way by violence in a relationship, which some people call domestic violence, but it's wider than that, and sexual violence. And then when we say that we help anybody who's impacted or affected, that means not just the primary victim survivor. It, like, if there's domestic violence going on and there's kids in the house, they're impacted, even if they're not directly a victim of that. They are, secondary victims. And so it can be a friend who maybe they know somebody who's been sexually assaulted and they don't know how to talk to their friend or how to approach the issue. They can access our services. And our services are advocacy, which is kind of a triage. They kind of help people who are in crisis. That's available 24 hours a day, 7 days a week. Then we have counselors. They see people individually as well as in group. And then I'm part of the education team, and we do education. About 85 to 90% of what we do is in the schools and probably K through 12. We also do present, at the universities in the area, as well as the jail and places like that. We were in 48 schools last year. So our coverage area is Cass and Clay County. We also go up into Trail County and down into Richland County, but mainly it's in Cass and Clay County. The services that we also provide, it's very important for people to know too, are free. We don't charge for the services. We don't limit people like how many times you can see an advocate or how many times you can see a counselor. It's whenever a person wants to come. And also it can be something that they've been impacted by 50 years ago. It doesn't have to be it happened yesterday. So that's just a quick little summary of what our services are. So in talking about violence in relationships, just knowing what the characteristics are of that is prevention. Really, prevention for when we talk about violence in relationships or sexual assault and those types of things. Prevention is for the people who would potentially be doing that, but it's good for all of us to be able to recognize the signs, of that it might be happening, or even sometimes we can recognize signs before it happens, and that's where we can step in. So we'll try and cover all of that today. So if you wouldn't mind, just in the chat, maybe just a few words, just thinking of the dating relationships that you view as unhealthy. What are the things that make them unhealthy? And not just dating, it could be relationships you've seen in your family or around you. Just if you could toss some words out, what are some things that make a relationship unhealthy?
You got some comments coming in through the chat here. I can read them as they come in. We have isolation. A few have shared controlling, lack of communication.
Okay. Yeah, I mean, those are perfect examples of what might make a relationship unhealthy. And so the isolation, the power, all those, we're going to go through the power and control wheel. I'll talk about that a little bit more, but those are some tactics or things that are right in there. So like I said, we do this a lot. We do this type of programming and ask this type of question on healthy and healthy relationships from ninth grade, young people on through adults. And so we've kind of compiled our own list, just from research too, and our experience of what are some of the main things that make relationships unhealthy. And then, like somebody said, the lack of communication. And of course, the big thing, remembering there too, that it's not just in-person communication, because so much of what goes on now is through social media or cyber communication. Of course, being dishonesty, when we have more time we kind of dig deeper into these sometimes a little bit, but just I won't do that, just out of respect for time. But just dishonesty in general, disrespect, too much dependence on one person, jealousy, hostility, control, intimidation. And then of course when we talk about violence at our agency, what we talk about is physical, emotional, psychological, and sexual, because often people just think of physical when we mention the word violence. And so some of these things, if you look at them, you know, like the top ones there, the lack of communication, dishonesty, maybe the jealousy, some of those can be, if they're standalone, maybe it's not like it's a relationship ender or that it means that there is violence. They're just things that if continued can make for a pretty unhealthy relationship. But there can be things like if it's going on in a relationship where somebody is a little jealous or a little dishonest in certain circumstances, people can work through those things. But when it gets down to the hostility, the control, the intimidation, and you know, like we have there, that's a pretty good warning that there's dating violence going on, and that there is in most cases there's going to need some other type of intervention in those situations for that to be worked through. Statistically, also, I don't have the numbers, but just statistically, people who are violent in relationships, I always hate to say this because it's kind of sad, but they don't change their behavior, unfortunately. There's programming. We do some programming at our agency for people who have, it's called our no violence programming. So we have groups for people who do use violence because we want to be holistic in our approach, as helping the victim survivor is paramount. But we also want to work with the people who are doing it, because if nobody does, then how does the problem ever stop? You know, so we do some of that. Programming there, statistically, it shows usually that, especially with the men, the group I'm familiar with, research has shown that their violence is not as severe, and sometimes there's longer times between it, but it's still statistically it's not very common for someone who's violent in a relationship that they just are able to stop that. So again, that's where I say that's kind of sad, but it's just a reality also. But that's like the difference here, where some of those things can be worked through. But when you get down to the hostility, the control, intimidation, a lot of times relationships end up, you know, ending for one reason or another because it's just not going to work. So dating violence, you know, it's also could be called dating abuse or relationship abuse. But the thing too that to remember is it's a pattern of abuse, and that again, it's no type of abuse is okay as far as we are concerned. But you can think of an instance maybe where somebody is upset with somebody and just totally out of character, let's say they slap their partner, and it's like, that's never happened. It's, you know, again, that's not okay. I'm not saying that's okay. But when we're talking about the domestic violence and the power and control, it's a pattern. It's not something that just happened out of the blue one time and never happened again, or, you know, but it's that pattern. And it's, again, it's trying to have that control. It's trying to have that power and that control over that dating partner. So just statistics, some people like them, some people are bored by them. So I only have 2 slides with statistics, but this just is talking about how common is intimate partner violence. And then if you look at, you know, the college age women between the age of 16 and 24 have the highest per capita rate of intimate partner violence. And then college students, again, it's about 1 in 5. And then 32%, about 1 in 3 college students report experiencing dating violence by a previous partner. So kind of gets into that gets in more to that control thing at, you know, kind of even after the relationship is over. Unfortunately, it doesn't always mean that the violence and the abuse is also over. And my only other statistical information is just when we talk about intimate partner dating violence with people in the GLBTQ plus community, and you'll just note there again, the numbers are much higher in those situations. Again, that can be a whole an entire another presentation, and actually we do have one that talks about the different barriers, the additional barriers that people in the GLBTQ community face, as opposed to say someone in a heterosexual relationship as far as reporting abuse. This is just a quick video. We'll see if
because I love you. I want to be your only guy.
Because I love you. Skip class with me. Let's stay in bed today.
Because I love you. I just want to be with you so freaking much. Because I love you.
I waited for you after Chem Lab.
You were walking with Mark?
Because I love you.
You shouldn't be hanging out with that dude.
You should know how dumb that makes me look. I don't care if she's your lab partner.
Why do you have texts from him?
Because I love you. This number, delete.
Because I love you. This Jason number,
Delete.
and Ben,
Delete.
because I love you, I should smash your phone.
I'll let you give me your password instead. Because I love you.
I will check your texts every day.
You got lucky. Because I love you. Because I love you.
You think it's okay.
Because I love you. You understand.
Because I love you, you stop talking to your classmates. And you feel completely alone.
Because I love you.
So I was just trying to emphasize the point that a lot of times, and I'll talk more about this after the power and control wheel, is that relationships don't start off that way. And it starts off, I'm doing this because I love you. And it can be like, oh, okay, that's nice. I appreciate you doing that. And then you can just see how it just spirals, where they try to have a person tries to have more power and control over their dating partner. So I don't know how many of you are familiar with the power and control wheel. It was established, I believe, in the mid 80s in Duluth, Minnesota. Duluth, Minnesota, they're programming their facility up there. They're a leader in the country, probably in the world, actually, when it comes to addressing the issue of dating violence and interpersonal violence in relationships. And in fact, the programming that we do with the abusers, the offenders, is a program that they started. It's the Men's No Violence Group. But anyway, this was created in Duluth, Minnesota, and at the time it was a group of women who were meeting on a regular basis to talk about what was going on in their lives. And somebody had the idea to ask them, well, what are the tactics? What are the things your abuser does to you that are trying to get that power and control? And they came up with these 8 pieces of the pie, if you will. And it's been looked at over the years. Like I say, it's probably been 40 years now, at least. And it's been looked at by victim survivors over the years, and it never really changes. At least the headings on these, that the tactics are still the same. So they've been around a long time. There are a number of different wheels, like specifically for the GLBTQ community. The headings are the same. It's just the tactics vary sometimes. But the thing is, again, that it's about power and control. And so that's how it's tried to be addressed with the offenders, that you're trying to have power and control, as well as then these tactics is just showing people who might be in an abusive relationship, just giving them some things to look at, like the first one there with the verbal and emotional abuse. Again, you can read through the bullet points there, but it's walking on eggshells all the time, to have to be on eggshells around a partner, because you never know what they're going to do or what they're going to say. And again, just this is anecdotal, but I've been with the agency for 8 years. And when I started, there have been people who've been here for many years. The Rape and Abuse Crisis Center has been around since the late 70s. So we have a long history. But the statistics are not gathered, but just anecdotally from people who've been doing this a long time, that most of the victims, survivors, say that this is the worst part of the abuse that they that's directed at them. People, like I said, none of it's okay, but people will say, if it's physical, they'll say, well, I can heal. My broken bones can heal. The black eye will go away, things. And with physical abuse, a lot of times it's not an everyday thing. So when you have the emotional or verbal, that's extremely difficult for people to hear, because they're hearing it every day. They're being put down every day. And especially when you put that in with isolation also. There's someone using their social status or their privilege, that they get to make all the decisions. They get to define the roles that people play in the relationship. Don't ask for input or opinion of their partners. So again, it's just kind of asserting their privilege in some ways. And again, we know as an agency that anybody can be a victim of violence in relationships. Statistically, it's around 90%, give or take, that the victims are female and the offender is a man. That's just statistically what it is. And so when we talk about privilege too, especially with the offender programming we talk about male privilege. And that's always an interesting discussion, because you can imagine that there's some some feedback, and some they take a little offense to that sometimes, but it's a good discussion that we're able to have with them. But it's just anybody using any type of privilege that they might have. Intimidation is another one that we see a lot of. Somebody, destroying things, smashing things, punching walls next to somebody's head, breaking things that are important to them. The abuse of pets is another thing that's kind of an indicator. If that's going on, that there's, good chance there's some type of other violence or abuse that's taking place in those relationships. We're unique too, that we serve, 2 counties, but we serve 2 states. And it's also interesting to see the difference, quite frankly, in how this issue is addressed through the courts and through the criminal justice system in North Dakota, as opposed to Minnesota. Minnesota is light years ahead. I don't know if you know the 2 states, you might be surprised, you may not. But I say that because when we talk about intimidation in North Dakota, people can be arrested for domestic violence if there's physical violence, and they can determine who the primary aggressor is. Minnesota, of course, has that. That's all 50 states have that. But then Minnesota also has the intimidation piece. So they go beyond, it doesn't have to be physical. Sometimes it can just be the intimidation or the words. And so that's good. That's inclusive, because that's a big part of it. Because a number of offenders or abusers know that if they step over the line and hit and leave bruises, they might go to jail. So they'll go up to that line and do all these other things. And unless it's a direct threat, of course, if someone says to anybody, like in North Dakota, I'm going to kill you, that's can be arrested for that, for terrorizing. But it doesn't get into the domestic piece then, which is a whole nother dynamic. So minimizing, denying, and blaming is a very interesting one. And I co-facilitated the men's groups here for the No Violence when we started that about 5 years ago. And I did it for about 4 years. So I had a lot of experience and a lot of hearing firsthand stories from the offenders. And this is huge, where they do not account for what they've done. And the number one thing, the co-facilitator and I would kind of, we just knew when we got a new person in the group, and we asked them, what brought you here? How come you're here? What did you do? What did you do? And almost always the first response is, well, she pushed my buttons. It was just a common, so right away there goes the blame to the victim survivor, that they caused them to react in the way they do. So it's a 26-week program. So that's what we work on for 26 weeks, trying to get them to the place to say, I hit her, I punched her, and it's my fault. Some do, a lot don't, but it's just interesting to see that the dynamic here. The other piece of this that is interesting is, I did work in advocacy for a year, and then just in talking with our advocates, it's not uncommon for a victim survivor also to do these same things, minimize, deny, and blame, because they've been told that so often. They will say, it's my fault. If I would have done X, then I wouldn't have gotten hit. Things like, it's not that bad. It was bad, much worse in the past. Right now, it's not as bad as it used to be. So again, they unfortunately, because of the isolation, the intimidation, all the other things, they just minimize, deny, and blame for themselves also. And then, of course, threats, making any kind of a threat through calls, texts, messages of any sort, spreading rumors. What the suicide piece, threatening suicide, also is one that is not an unfamiliar tactic for an abuser, especially if the victim survivor has left, or gotten gotten a protection order. Then it's not uncommon for them to call or text and say, hey, if you don't come back to me, I'm going to kill myself. And that can present a whole other, list of problems. If there's children involved, it's like they don't want that to happen. They may still care and love for the person. I mean, it's not like most of them aren't going to say, well, have at it, do what you want with your life, I'm done. they're usually connected still somehow, and they don't want to be blamed also. They, thinking that they'd be blamed or have some guilt. So that's it's a dangerous time when someone is threatening suicide, because it's not much of a step then to also harm, to the other person. The sexual coercion is another one, just manipulating their partner into doing sexual things that they don't want to. It's interesting to have the conversation about consent with, I go back to my experience with the offenders in the group, and some of them, and I think for the most part, they're fairly honest with us when we get into discussions. And so I don't think they're making it up, but I would say a large number, surprising number, these are adult males, don't know what consent is. When we explain what consent is, that it's permission, and then also say that your partner needs to give consent or permission for any type of sexual activity, they're like, oh, no, 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 no. What are you talking about? Because again, they view it as, well, she's mine. If I want to have, if I want to engage in a sexual activity, I will. It doesn't matter what their thoughts are. We're married or we're in a relationship. So again, this is a big piece of it. It's a piece of it probably that isn't talked about a lot, because it's, again, one of the reasons that when we go back to the minimize, deny, and blame is with the victim survivor, is they feel some embarrassment or shame. They're going to talk to a stranger about these things. So the offender knows that too. They know that it's difficult for their partner to go talk to people about the issues that are happening. Isolation, exclusion. Isolation, like I said, is a big one when it goes back. Also, if you couple that with the verbal or emotional abuse, because as I go through these, and I should have said this in the beginning, nobody has to check every box to decide their relationship is abusive. It can be one thing. It can be one of these pieces of the pie that, yes, this happens a lot. You don't need to check a certain amount. But so when you add the isolation in with that verbal abuse, imagine that a person is told every day things like, you're fat, you're ugly, you're stupid, you're crazy, nobody likes you, your family hates you, nobody believes you, over and over, and then you're isolated. So you have no outreach. The person is controlling who you talk to, when you talk to them. It may be when you visit with other people, whether it's a phone, text, or in person, they need to be in the room with you. So you are totally under that person's control and totally isolated. And again, so that's all you're hearing is those negative things. So you can imagine how devastating that is, and why some people say that's the verbal is the worst piece of it. Economic abuse is another tactic that's used pretty frequently by offenders, in that we see people who come in, to advocacy, who professional people who are, well paid, but they don't have any money. And sometimes they come in looking for a referral to the food pantry or a $25 gift card to go to the grocery store, because they get an allowance and they have to make do with that. And if they don't, they're in trouble, because the other person controls the money. It's almost like treating them like a child. Here's your allowance for the day or your allowance for the week, and you can't go over that. And so again, when we get to the other piece of this, because we talk about this in the schools especially, and then we go back later and talk about healthy, we get into ways to address that, because we don't have a cookie cutter. We don't have a way that says, here's the recipe to not have economic abuse. It's just having that communication and that conversation is what it's about. But if one person decides, I'm in control, and sometimes you will see also where that person may be the only one working, they won't allow their partner to work. And so then they justify, well, I get to make the decisions. Or if they do make more money, again, that's a justification to them, as I make the most money, so why can't I make these decisions? So they find ways, obviously, to justify their behaviors. Of course, cyber dating abuse. A lot of these things with that wheel, especially the verbal and the intimidation stuff, don't have to happen in person. They certainly, can happen through text, phone calls. There's other things, though, that you can add to this, from the wheel when it comes to the cyber dating abuse, is things like demanding passwords. I need to know your passwords. I need to see who you're talking to. I get to decide who you text. You have to answer me within so many minutes of a text, or else there's a problem. I remember once when I was in advocacy visiting with a woman who came in, a victim survivor, and she left within 15 minutes, and she left the room a couple times, and then she finally said, I have to go. She said, he's texted me 48 times since I've been sitting here wanting to know where I am and what I'm doing. She said, I can't do this, I have to go. So it's that kind of thing. Also with when you talk about the cyber and all those types of things, is just tracking. Again, I remember a woman coming in and she was so nervous, which is typical, but she said, I was only supposed to go, we're located in downtown Fargo by where the old Taco John's used to be. So I just tell you that because this woman said I was supposed to only go from the house to Sun Mart, which is Family Fair now on 7th and University. And she said, I came further to where you are, which is about 6 blocks. And she said, he's going to know because he checks the mileage, he checks the GPS, and he's going to know that I went further, and I don't know how I'm going to explain this. So again, that's just an added thing that before our technology didn't exist. I mean, somebody could check mileage and stuff, but the tracking, so tagging things. So there's just a lot more that can happen with cyber, again, that fits under that power and control umbrella. So some common signs that a person might see impacts of dating violence. And again, it's important to know that any one of these things, of course, doesn't mean there's dating violence going on, but they're things that can, if you observe them in a friend, family member, whatever, coworker, that at least somebody asks some questions. I've noticed these changes, or what's going on. So, like the hopelessness, feeling unworthy, you can imagine, again, if that's what you're told all the time, that you're not worthy, you're no good. And the hopelessness piece of it is not seeing a way out, that you're in this relationship and feeling like you're stuck and just not feeling a way out. And so, yeah, you would be very discouraged about your future. What am I going to do? What can I do? The inability to trust anybody, because again, this is a person who you're in a relationship with, who maybe they're married to, and you should be able to trust with your life, and it's totally the opposite. And so that, of course, is going to impact a person's ability to trust anybody. Again, feeling unmotivated. If you're feeling trapped and you're feeling unworthy, it's like, what's my motivation to even do anything? If I can't get out of this relationship and this is my life, what's my motivation? So things you could even see changes in people, of course, like if it's a new relationship. If it's a new relationship or somebody you just met, you may be seeing changes in this person, like in school. You might be their grades just go down. They don't go to class anymore. They're part of a team or something, or a committee, and they don't show up anymore. If you see those changes happening, that could be an indication that there's something going on with that person and in that relationship. So again, it's not jumping to, I know they're in an unhealthy relationship. It's jumping to myself or someone should ask this person some questions. We've seen some changes in your behavior. How are things going? Just being open to people and letting them know that they can talk to you about those things. Of course, it's going to impact somebody's mental health. Traumatic brain injuries are not uncommon also in relationships where there's physical abuse, because just the violence of hitting someone in the head or knocking them down, throwing them down, or the strangulation, obviously is unfortunate. It's kind of common in relationships where there's physical abuse, where there is strangulation to the point of almost unconsciousness or unconsciousness. And again, that's control. And the message to the victim is, look what I can do, and I could do worse. And so again, you experience that, the PTSD, a person might experience the depression, anxiety, all those different things, always that anxious about, even at work or school, are they going to show up? Or, and sometimes they might be standing there waiting for a person when they walk out of class or they walk out of their office, they're just standing there. So it really messes with a person, not only emotionally, but also physically. and they may, again, with that feeling of hopelessness and those types of things, start using drugs or alcohol. Self-harm, eating disorders are not uncommon. So again, as a friend of somebody, family member, somebody who has fairly um, um, frequent contact with somebody, and you start to see these changes, again, especially when it's a new relationship and all of a sudden this person's changing. Of course, in a new relationship, people are going to spend more time with their partner right away, probably, and do more things. But if it continues on, or if they really start to isolate and not do things with other friends, or even the situation where, of course, if you ask somebody to do something and they say, oh, I'll check with my husband, my wife, or my partner, my boyfriend, girlfriend, and see if they, if they had any plans tonight, I'm not sure. That's one thing. That's being respectful and kind. But if it's, I have to check and see if it's okay, that might be an indication that there's a lot of control issues going on there. So just a few things that a person might see. And like I said, unfortunately, also when these relationships, when the people do separate, it doesn't mean that it's over. It again, on occasion, and it seems like the ones that in this area, Fargo-Moorhead, the area, the most recent ones where there's been a homicide, suicide, it's been relationships have been over. The people have been separated, and you want to feel that you're safe and okay, but that power and control is just so strong with that individual that they can't allow that to happen in their mind. They can't allow this person to see someone else or start a new life. So you might see things like stalking. They're still following the GPS, the tagging, things like that, threatening them. Again, I saw you, just getting a message. I saw you with so-and-so at this place. How unnerving that is. So everywhere you go, you're looking over your shoulder, just intimidating again. They're really good at intimidation and manipulation. Offenders are. The manipulation is amazing, and that's kind of an overreaching thing too. When you look at that whole power and control wheel, is that sometimes when a person who is in an abusive relationship and they tell a friend or family member and they report it to them, sometimes the reaction is, I don't believe that. That person is the nicest person I've ever met. They've helped me with this. They did. So the manipulation is huge, where their real behavior only comes out when they're alone with that person. It's so other people don't see it. So sometimes they have a hard time believing it, or they'll say things like, well, what did you do? Like it's their fault again. So one thing that we also is big with offenders in working with them and trying to get them to recognize that their behavior is controllable, because they'll come in sometimes and be like, I can't control my behavior. I have a temper that goes like that. That's the problem. My experience with them, I thought it would be more of, I do this when I've been drinking or using drugs. I didn't hear that a lot. So some of them did, but I would say the majority didn't fall back on that excuse. But it was the bad temper. And so then we try and use with them, well, do you do this to other people? Do you treat your co-workers this way, your siblings, your parents? And then they're like, well, of course not. And then try to make that connection that, okay, you're controlling your behavior when you're at work. So you can control your behavior when you're at home. That it's a choice that they're making is we try and get across to them. Then sexual harassment or revenge porn. I think we'll talk a little bit a little later. Well, in the one with the cyber, I should have mentioned like sexting. So sharing nude photos and being coerced to do that, or blackmail, like it's not a choice that someone made. Some people may make that choice, but others that may be coerced or are blackmailed, threatened, intimidated, with the promise always being, they're for me and no one else will ever see these. And so now there are laws against revenge porn, because it became such a thing that once that relationship ended, those pictures appeared all over the place. And so that's another thing that can happen post-separation. Like I said, that the abusive dating relationships, they don't start off that way. Because another thing that we find with victim survivors is that like I said, there's some embarrassment and shame and guilt, which there shouldn't be. Just a second, I got something that popped up on my screen. It's going to disconnect me, it looks like. Okay. Is that they are ashamed because they'll think, I chose this person. What's wrong with me because I picked a person who abuses me? And it's so important for people to understand that that's not true. That's not true. Because when relationships start off, everybody's usually on their best behavior. So it's another sign that the person who's controlling can't control their behavior. But it comes over time. And so no one should ever feel bad, like, what did I do because this woman wasn't like this when I met them, and now they are. It's because they're manipulating, they're controlling, and they know how to do it. So again, like I gave the example when we listed the unhealthy, is some of those things like maybe being a little dishonest. Well, I didn't want to tell you because I didn't want to hurt your feelings. Okay, depending upon what it was, how severe it was, it could be like, okay, I appreciate that, but please don't do that again. You hang a lot, Friday night you were going to go out with your friends. I thought we were going to go out and have a good time. I really wish you would. That's nice. I'll do it with my friends another time. So a little bit of jealousy. That sounds okay. But now it's every week. I don't want you seeing them. I don't want you hanging around with them. You spend too much time at your mom's. You shouldn't go over there all the. They're master manipulators because they start with these little things that they're not red flags right away. And then by the time it gets to that, it's like, oh man, what's going on here? So again, it's important for people to understand that they are not ever responsible for the abusive behavior, and they didn't do anything. That person was that way, and they just controlled their behavior until they felt more comfortable in the relationship and felt they were at a position where they could do those things. And again, it can happen to anybody. Like I said, it doesn't race, religion, creed, disability or not, your gender identity. Some people tend to think that we hear sometimes people who are have higher education, people who are economically better off, that those things don't happen. They do. That doesn't prevent it at all. It's just sometimes in those situations, it never gets to anybody else because the person is more. And when we talk about like higher income, it's like it's a reputation for everybody, for the family, for whatever. They may be just more isolated as far as their living circumstances. A higher income a person, it's been discussed and talked about when we talk about this type of thing. Also, is that if you look at people, and I can say from the guys who came in our group, they do a whole inventory they fill out. It's your education, it's your income level, do you have health insurance, it's all those things, that the vast majority were probably lower income or unemployed. And so, people have looked into these things too. And one of the things they say is that people on those ends of the spectrum, they may live in apartments, they may live in trailer homes, where everything is heard more, where people hear it and see it more. And so other people may be calling in or reporting this, because most victims of abuse do not report it themselves, at least to law enforcement. They don't report it themselves. That usually happens from an outside person. So you can imagine somebody who's more well off and lives in a larger neighborhood where their neighbors aren't close or whatever, nobody else is going to hear or see what's happening. And so again, it's not reported as much. So that might give people the idea that it doesn't happen amongst the higher income people or doctors or lawyers or police officers or things like that, when it does. It's just, again, how often is it reported and who's reporting it? So if a person is experiencing dating violence, again, we obviously encourage them to tell someone. Don't be afraid to talk to somebody. And that can be challenging because we have, when someone comes into our agency and says, I want to leave this relationship, one of the first things we say is, do you have family? Do you have anybody close you can go stay with? And sometimes they'll say, my family won't take me in anymore because I have left before. And so they're tired of me and they will not help me anymore. That's that's so devastating, obviously, to a person. I get the other side of it where it might be frustrating, but if you know all these other dynamics, then it's easier to say, yes, we'll do what we can to help you. But if people don't understand all the dynamics, it's just they think it's easy to leave when it's not. And so here, this is very generic, but like at NDSU, I know that you do have advocates there, I believe, and people that you can go talk to about this there. You, of course, have access to the Rape and Abuse Crisis Center. Reporting it to anybody, any person in a position of authority is something that a person can do. And if someone does come and report to you, again, no matter what their relationship with you, it's so important to make the time to listen to them, let them know you believe them and you want to help, and not saying things like, well, what did you do? Why don't you just leave? But what can I do to help? Because again, if someone has built up the courage to come and talk to somebody and the person says, not right now, I have this to do, let's make an appointment, you probably will never hear from that person again. So again, if somebody does come to you, it's important to make the time to listen to them and let them know that you're there to help support whatever they need. And so again, what you need, again, teammates, classmates, friends, whatever it is, family, just understanding like you're getting here today, kind of more of an understanding of violence that happens in relationships, not judging them at all, not saying it doesn't sound bad or whatever. Just, again, hearing them out, listening. I'm here to support you. What can I do for you? A person in an abusive relationship, they are really the only one who knows when it's safe to leave and when it's okay to leave. It's hard. Like I said, when I was in advocacy, sometimes you hear some of these stories and things, and I wanted to say, it's time to go. Let's figure this out and you get out of there. That's not for me to decide or anyone else. They know when it's safe. Because one of the, I learned quickly that like someone was the texting and the calling, and I would say like, can you just block them? That just seems like a small thing to do. But they're like, oh, no. I have to respond once in a while, or I have to know how mad they are and how, can I go to where they're at or should I just stay away? So again, on the outside, it looks like, well, here's some simple solutions for you. That person who's the victim survivor, they know when it's okay and they know when it's safe to take next steps. So I'm not going to spend a lot of time on this because bystander intervention is important, but it's important to recognize the signs and the wheel that we just talked about and changes in people's behavior. If you actually see something happening, of course, we would like people to step in and intervene as they can. And what we use are called the 3Ds. It's just being direct. It's going up to the person who either is hurting someone or the person who's being hurt, either one, and saying, what are you doing? That's not cool. Stop that. Or up to the person who's being harmed and saying, are you okay? Do you need anything? Can I help you in some way? And these can be used in a lot of circumstances. It doesn't just mean interpersonal violence, or you might see something before a sexual assault takes place with people drinking and stuff like that. But anything where you see someone just arguing, you see somebody maybe being a little harsh with a child that looks like this is stepping over the line a little. These are just things that we talk about that a person can use. Direct, of course, is we emphasize that people have to feel safe. If they don't, then don't do it. But then also it doesn't mean you just stop and don't do anything. There's delegate, which when we talk to kids in high school, of course, it's talk to a trusted adult. Can be adults. You talk to someone in law enforcement. You talk to a professor. You talk to a dean. You're at a business, you talk to the manager, you talk to the bouncer. It's just making someone else aware of what you're seeing and hearing so they can hopefully take some action. And the last one is distract. And distract is a very temporary one. That'd be like, again, and I've used this in walking downtown Fargo a couple times. It's fairly simple and it usually seems to work. Is two people arguing, or it looks like one yelling at another one. I've just stopped and said, excuse me, I am so lost. I can't find, where's the library? Where's Casey's? Where's anything? And you're just distracting for a moment and you're hoping that creates a change in that behavior at the moment. Distract is not one that's going to cure the problem. It's one you probably, if you distract, you still need to delegate or do something later on. but it stops that at that time. And usually when I've done it, the person who was upset and yelling, as soon as I said that, they're off. And the other person kind of stays back. And I just said, are you okay? And so, I mean, that's just a pretty easy, simple example of direct. So I do have a couple of scenarios here. We can try maybe one or two, and then leave some time for questions. So this is just a scenario, and if you want to just throw things in chat, that's fine. You can go ahead and read that. You're at a date or concert. As you're moving up the line, you see and hear a couple arguing loudly. The man is grabbing his partner by the arms and starts yelling at him through gritted teeth. Just being honest again, we all have barriers, things we're not going to do. But so if you want to say what you might do, or if you want to throw out a barrier and say, I wouldn't do any of those for some reason. And I know this isn't anonymous, so don't feel like I don't know who's answering, but if you don't want to say anything, that's certainly fine too. But if anybody wants to, and it doesn't mean you would do it. You can just throw out ideas.
Yeah, one comment. I would seek out a manager / supervisor at the concert or security.
Okay, so that's delegate. Yep.
We have another, I would just ask if everything is okay or if someone needs help. And then another share, I would keep an eye on them the rest of the night.
Okay, yeah. So it's being direct. It's kind of, yeah, and then just kind of keeping an eye on them. Those are all perfectly good answers. When we go through these scenarios and we talk about these ways to intervene, there's no right or wrong answer, and a person may do all three. And on another barrier may be that, yeah, someone watches and like, well, I'm not sure what's happening there, so I'm going to keep an eye on it. Those are pretty common, and we all have them. No one should ever be ashamed of having a barrier to any of these. At the time, sure, we can go through this one. Maybe you're at an off-campus party and you see a woman who's obviously intoxicated being pulled by a man towards a bedroom door. You hear him coaxing her to go in with him. You saw that at any type of an event, party, maybe a house party. Doesn't have to be that you see something like that happening. What are some things you can think of that you might do or that might be a barrier for you?
We have someone share, I would pull her to the side and get her thoughts.
Okay, being direct with the victim survivor in that case, or the potential victim. Sometimes it's as easy as saying, just like, don't I know you? Or didn't we used to live next door to each other? That brief distraction where it stops it for a minute,
Yeah.
just anything like that.
Yeah, we had a comment that aligns with that a little bit there. I would distract the man, try to get the woman to join me at the party. Yeah.
Okay.
Immediately intervene and try to find a friend for her. Another comment. I love the engagement. This is great. Another participant share, find the host of the party to let them know what I witnessed.
Yeah, great answers. Anything like that. And a lot of times those are going to work again. And then it may be, maybe later on. We've had people say, like with the delegate here too, is that if they know another, in this case, it was a man, if they know like another person or a guy who might be a teammate, friend, whatever, and telling them, say, hey, look what's going on. Can you go get him or something? So when it comes to these, it's what your imagination, whatever you can come up with. Again, we want people to be safe, but there's a lot of different things a person can try in these situations. We'll do one more. It's the last one. I think there's still time. So you're in a classroom and notice two students. So this would be more for, it could be a fellow student, I guess, or a professor, who are always together. One of the people's behavior has changed. One person seems shy, introverted, head down. The other seems to be talking to them in an intense manner and always like looking or staring at the person. So this is one where there's been a change in the dynamic. And if you're not seeing anything, Melissa, that you can just let me know. And
We did have something just come through. Ask the shy student to stay behind to discuss an assignment, to ask if they're okay. We had another share. I would engage in the conversation with the person whose behavior has changed, just to check in on them and see what I notice.
perfect. Yeah. Checking in with that person and also asking them to stay after would be so important that I need to see them alone, because I can tell you that abuser is going to want to stick right there with that person. If somebody else, it's like when you go to the doctor and usually the nurse will ask, "Are you safe at home?" Sometimes in those situations, a real controlling, abusive person is going to want to be in the room with them. And so, again, when we talk to medical people, we say, don't allow that. Don't allow that. Or a child who may be thinking that there's something going on. Separate them as best you can. So, any questions, comments, concerns, anything you have for me? We're available. You can go online and find us. Our advocates are available 24/7. We have all kinds of brochures and tear off cards that we can get to the university if they want to make use of those things.
I did just want to jump in. We did have a couple of people also add some more
Okay, sure.
feedback
Sure.
to just to acknowledge that as well.
Yeah.
We had one share ask one of their friends, again from the previous scenario,
Sure.
another share, complicated, could be anything. I would ask for help from the person with observed changes and get them alone and see if they need anything, are okay, and let them know about resources. So kind of
Awesome.
discussed
Awesome
there.
answer. Yeah, that's
Yeah.
great.
And then we have a couple of, or some comments from the participants as well. This was excellent. Thank you. Thank you for being here. Thank you. And yeah, it was a great session. So
Oh,
thank you.
well, yeah, you're welcome. I'm so happy to do it and glad that you allowed me the time to come and visit with you.
Absolutely. Yes. Thank you so much, Greg. And, we always, it's really an important topic and something that just needs to continue to be discussed. And so we're very fortunate to have you come and share that with us. We do have people kind of slowly transitioning out. And so I did quickly, as people are transitioning out, I know you just shared a great resource, knowing the Rape and Abuse Crisis Center is, a great community resource and a resource that can be used faculty, staff, and students, essentially our whole community, right? Knowing that we're not in a bubble, right? We're, people in the community as well. To add to that, I did just want to share just quickly as people are kind of circling out, but knowing that we have our Equal Opportunity and Title IX Compliance Office and that there are, reporting standards for, entering a complaint, whether you have personally been subject to that violence or if you have witnessed it. So all NDSU employees who are mandated reporters, are required to report that. In addition to that kind of reporting aspect, just knowing our NDSU and community resources, knowing of the Rape and Abuse Crisis Center, knowing, we do have an advocate on campus with our student health service, and knowing that, the students specifically in the instance, the students don't necessarily have to file a complaint to still get those support services. So it's always available, and we want to continue to highlight that. So knowing we have an advocate, our student health service, and then other resources as well. We have like the NDSU Counseling Center and care team, and regardless, and we have each other as well, and knowing that too. So to be able to kind of navigate that and, keeping, as you shared, Greg, keeping those channels of communication open and, and not being afraid to, intervene if needed, but then also being able to share those resources. And even if we don't have the answers, still keeping, your arms open and to be able to direct somebody else in that right direction is very, very important and valuable. So perfect. So we have some more comments. Great session. Thank you. Great session. Thank you so much. This session was very informative, and I can echo that. So
good. Glad to hear it. That's the purpose. So I'm very glad to hear that.
Wonderful.
And thanks for the opportunity.
Yes. Well, I believe that concludes our session. And so I always kind of stay on to in the event that anybody does have any questions, but feel free to kind of transition out as well. I know we're right at the hour mark, but thank you all for attending, and thanks again, Greg, for presenting. This is wonderful information, we look forward to continue to share this. So
all right. Thank you.
thank you, everyone.
Yeah.
Perfect. Tabitha, do you have any questions that I can answer or any comments about the session before we close out the session? Give me a second here, but otherwise you're always welcome to email myself or our health promotion email as well. We're always open to any feedback, but thank you for attending. Perfect. Alrighty, well, we'll go ahead and exit out, and thank you so much for attending. And thank you, Alyssa. Perfect.